Hello friends, in this section of head and neck, we are going to complete another important topic, that is cavernous sinus. Cavernous sinus is a very important topic for questions, often long questions or short questions come framing about cavernous sinus. Also in the theory examination, it is often asked so many times. Also it is an important question for the viva, so you should know all the communications, you should know which are the relations of cavernous sinus, what is the applied anatomy of cavernous sinus. It's a very important topic and you can't skip cavernous sinus. So coming into the details of cavernous sinus. So starting with the topic, the first thing which comes in the mind, that where is cavernous sinus located, how it is formed, what is the reason of formation of cavernous sinus. So this cavernous sinus is approximately 2 centimeter to 1 centimeter, means 1 centimeter width and 2 centimeter length, and actual reason of formation of cavernous sinus is separation of 2 layers of dura mater. Now this cranial dura has got 2 layers. It has got a meningeal layer and it has got an endosteal layer, and this meningeal and endosteal layer separate to form cavernous sinus. So in the exact location is, it is lying on the either side of body of sphenoid, and it's formed due to separation of these 2 layers. It is just anteriorly, if you will see, it is related to supromedial aspect of the superior orbital fissure. So this was just an introduction part of cavernous sinus, and as I told you, it is formed by the separation of 2 layers, that is endosteal and the meningeal layer. So if you will see the cavernous sinus, the floor of the cavernous sinus is formed by the endosteal layer. Means the endosteal layer of the dura mater is only contributing in formation of floor of cavernous sinus. The meningeal layer is forming the roof, the medial and the lateral wall of cavernous sinus. So major part of cavernous sinus is formed by meningeal layer of the cranial dura, that is, it is forming the medial, lateral wall and the roof. Now coming to the, so how you are going to approach the answer? After the introduction part, you have to write the extent. Write on the heading extent and then write extent of cavernous sinus. So this cavernous sinus is extending on the anterior aspect. When you will see the anterior extent, it is anteriorly extending on the supromedial aspect of superior orbital fissure, or the junction, or you can say it is at the junction of the superior orbital fissure and that of optic canal. Posterior extent is till the level of apex of petrous temporal bone. So anteriorly lies superior orbital fissure, anterior extent is till the level of superior orbital fissure, and posteriorly it is ending at the level of apex of petrous temporal bone. So this was all about the extent of cavernous sinus. Now coming to relations of cavernous sinus. So important relations of cavernous sinus is following. It is related to anteriorly, so we will discuss all the relation. We will discuss superior relation, inferior relation, anterior relation, posterior relations, and also medial and lateral wall. So coming to its superior relation, superiorly the relation in cavernous sinus is, it is superiorly related to optic chiasma and optic tract. So on the superior aspect of cavernous sinus lies optic chiasma and optic tract. Along with it, you can see internal carotid artery and anterior perforated substance. So what is superiorly related in the cavernous sinus? Once more, on the superior aspect, cavernous sinus is related to anterior perforated substance, internal carotid artery, optic chiasma and that of optic tract. Now coming to posterior relation, posteriorly the cavernous sinus is related to, so before posterior I would like to go in sequence. So let's discuss firstly the inferior relation. So we have already discussed the superior relation. Now coming to inferior relation, inferiorly cavernous sinus is related to foramen lacerum. Which foramen? Foramen lacerum, and as we know, foramen lacerum is located at the junction of body of sphenoid and that of the greater wing of sphenoid. So inferior extent or inferior relation of cavernous sinus is at the level of, it is inferiorly related to a foramen, that is foramen lacerum, which is located at the junction of Which junction? It is located at the junction of body of sphenoid and that of greater wing of sphenoid. So this was about superior and inferior relation. Now coming to anterior and posterior relation. So anteriorly it is related to optic canal and superior orbital fissure. Two structures of the orbit, that is superior orbital fissure and optic canal. These two structures lies on anterior aspect of cavernous sinus, and posteriorly it is related to crux of midbrain and that of apex of petrous temporal bone. Two structure, crux of midbrain and that of apex of petrous temporal bone. So this was all about superior, inferior, anterior and posterior relation. Now coming to medial and lateral. So now what happens? As we know, this cavernous sinus is located on either side of the body of sphenoid. In the middle of the body of sphenoid, there is a hypophyseal fossa, and in this hypophyseal fossa lies pituitary gland. So medially it is related to pituitary gland and also with the sphenoidal air sinus. Two structures is composing the medial relation. What is it? Pituitary gland and sphenoidal air sinus. Now coming to lateral relation. Laterally it is related to the temporal lobe of cerebral hemisphere. So what is the lateral relation? That is the temporal lobe and of the cerebral hemisphere and also the trigeminal ganglion. So these are all structures which is relating to cavernous sinus. You have to make a good label diagram showing all these relations. You have to not miss any of this relation. All these relations should be enumerated. Along with it, you have to make the diagram. I will make the diagram along with you, and you have to practice that diagram so well that on one attempt you are going to make this diagram in the theory papers. Now after that, coming to structures which is lying in the lateral wall of the cavernous sinus and structures which is lying inside the cavernous sinus. So this is often asked as a viva question also. Which four nerves are lying in the lateral wall of the cavernous sinus? So the answer is following nerves are related into the lateral wall of cavernous sinus. Third, fourth nerve, that is oculomotor nerve, the trochlear nerve, and the two division of the fifth. So which two division? Ophthalmic and maxillary. So in short you can say third, fourth and fifth. But the trigeminal only two divisions are related in the lateral wall, that is the ophthalmic and maxillary. So four nerves are related in the lateral wall of cavernous sinus. What is it? It is oculomotor, trochlear, ophthalmic and maxillary division of trigeminal nerve. So this was the relations of the nerve which was found on the lateral wall of cavernous sinus. Now coming to the relations which are found in the medial wall of the cavernous sinus. Medial wall, not exactly medial wall, means it is going inside the cavernous sinus. So the structures related to medial aspect is two structures, internal carotid artery and abducent nerve, sixth cranial nerve and internal carotid artery. So this was all about the relations of cavernous sinus. After this, I would like to explain the tributaries and communications of cavernous sinus. So let's come into the discussion of tributaries and communications. Tributaries of cavernous sinus. The important tributaries are from three sources, that is the orbit, meninges and that of brain. So three sources are there for forming the tributaries of cavernous sinus, and you should know all these tributaries. So from the orbit we have got three tributaries, namely superior ophthalmic vein, inferior ophthalmic vein and central vein of the retina. So three tributaries from the orbit: superior ophthalmic vein, inferior ophthalmic vein and central vein of the retina. Coming to the tributaries from the meninges we have got two tributaries. The first is sphenoparietal sinus and the second is anterior trunk of middle meningeal vein. So two tributaries from the meninges, sphenoparietal sinus and anterior trunk of middle meningeal vein. Tributaries are also from the brain, and we have got two tributaries from the brain. The first is superficial middle cerebral vein and the second is inferior cerebral vein. Actually these all tributaries should be tip of your mind because it is often asked in the viva, enumerate the tributaries of cavernous sinus. Also the question can be framed like this in the theory paper also, enumerate the tributaries of all the tributaries of the cavernous sinus. So you have to first write the heading from orbit, from meninges, from brain, and then you have to enumerate all these names which I have just told you, three from the orbit, two from the meninges and two from the brain. So after completing the major name of the tributaries, let's see the communications of cavernous sinus. So there are so important communications, so many important communications are there in the cavernous sinus, which I will just explain you. The tributaries I will explain also with making a diagram. Now coming to the communications. Now in the communications of cavernous sinus, as we know, there is two cavernous sinus on either side of body of sphenoid. How many cavernous sinus? We have got two cavernous sinus on either side of the body of sphenoid. Now these two side cavernous sinus is also connected by sinuses, and the name of that sinus is anterior and posterior intercavernous sinus. So the two connecting sinuses in between the bilateral cavernous sinus is anterior cavernous sinus, intercavernous sinus, and posterior intercavernous sinus. Thereafter, coming to other communications like from the inferior petrosal nerve. So there is inferior petrosal sinus, and through this inferior petrosal sinus, cavernous sinus communicate with internal jugular vein. So cavernous sinus can also communicate with most important vein. All the venous sinuses ultimately drain into internal jugular vein, and cavernous sinus is communicating with internal jugular vein via inferior petrosal sinus. Superior petrosal sinus communicate cavernous sinus with the transverse sinus. So we have got two sinuses, superior and inferior petrosal sinus. We have seen the inferior petrosal sinus is communicating cavernous sinus to internal jugular vein. Here the superior petrosal sinus is communicating cavernous sinus with transverse sinus. Thereafter, coming to the other communications, as we know that one of the most important tributary is superficial middle cerebral vein. This superficial middle cerebral vein communicate cavernous sinus with superior sagittal sinus. The sinus, superior sagittal sinus. So through superficial middle cerebral vein, there is communication between cavernous sinus and that of superior sagittal sinus. Other than that, there is pterygoid venous plexus. Also, there is emissary vein. So, emissary vein is also forming so many communications. Now, there is facial vein which is lying externally on, which is extracranial, means it is lying on the face, it is extracranial. Now, this facial vein communicate with deep vein communicate with pterygoid venous plexus, and pterygoid venous plexus communicate with that of emissary vein, and ultimately emissary vein connect it with the cavernous sinus. So this is a route of infection to traverse. So once more, the communications which is formed through facial vein. Facial vein communicate with deep facial vein. Deep facial vein is communicating with that of pterygoid venous plexus. Pterygoid venous plexus is communicating with that of emissary vein, and emissary vein is communicating with the cavernous sinus. This was the one route. Another route is superior ophthalmic vein. We already know one of the tributary of cavernous sinus is superior ophthalmic vein. Superior ophthalmic vein communicate with angular vein, and angular vein communicate with facial vein. So these are important communications. Also, internal vertebral plexus can communicate with cavernous sinus through basilar venous plexus. So these are important communications. So if the question comes, as long question comes, you have to mention all the tributaries and also all the communication and showing a good label diagram. Thereafter, we have completed all important relations, location, extent, tributaries and that of communication. At the end, I would like to give applied anatomy of cavernous sinus. So what happens? Cavernous sinus is sometimes what happens, there is a dangerous area of the face that is lying below the nose and above the upper lip. This area, infection from this area can drain into cavernous sinus, causing cavernous sinus thrombosis. So it is a very grave condition, that is cavernous sinus thrombosis. As I have already discussed that through facial vein, that can drain into deep vein, through deep vein into pterygoid venous plexus, through pterygoid venous plexus goes to emissary vein, and through emissary vein it communicates into cavernous sinus. So if this area, that is the area lying up above the upper lip and below the nose, is infected, facial vein can communicate at times with the cavernous sinus, and the condition is very grave, called as cavernous sinus thrombosis. In this case, as we have already discussed, that cavernous sinus is related with third nerve, fourth nerve and sixth nerve. This third nerve, fourth and sixth nerve is the major nerve which is supplying. Means these all nerves are supplying extraocular muscle. So there will be a condition called as internal ophthalmoplasia. Means all the muscles of eye will be paralyzed, and this condition is called as internal ophthalmoplasia. The other conditions, abnormalities which we will see, there will be more venous pulsations, there will be blood oozing out and more venous pulsation will be seen in the cavernous sinus. So these are some of the applied aspect. Also there we know that in the lateral wall there is ophthalmic division of trigeminal nerve. So through this communication, or what will happen, there will be severe forehead pain in the case of cavernous sinus thrombosis. Now the other applied aspect is that sometimes what happens, the base of skull is fractured. If the base of skull is fractured, the cavernous sinus forms communication with internal carotid artery. If you remember, when we were discussing the relations of cavernous sinus, I told you internal carotid artery is related to medial aspect of cavernous sinus, and at times when there is fracture of base of the skull, internal carotid artery form communications with the cavernous sinus, and what will happen, there will be arteriovenous communication. Now inside internal carotid artery, the blood is flowing in high speed, and this blood will rush into the cavernous sinus and it will make the cavernous sinus pulsatile. So in this condition, what will happen, you can also feel systolic murmur on the eyes. Also what will happen, there will be internal ophthalmoplasia, there will be pain, there will be pain around the eyes and the forehead, and there will be exophthalmos, the eye will bulge out, there will be exophthalmos, and there will be pulsating eyeball. Along with it, there will be systolic murmurs heard on the eye, around the eye area. So these are the often sign and symptoms which is seen if this condition happens, and these two conditions are very grave conditions. It should be treated as early as possible because it is a very severe conditions. Now in the case of cavernous sinus, whenever the question comes, you have to end with giving these two applied anatomy also. You have to write the clinical aspect related with the cavernous sinus also. So if you want to write the answer of cavernous sinus, all these points which I have told you, you have to write all these points. Along with this, you have to make diagrams, which is very important. That is one diagram showing the relation and other diagram showing the tributaries of cavernous sinus. So with this, I finish the topic of cavernous sinus. Now starting with the tributaries and communication of cavernous sinus. So we will make the diagram showing the tributaries and some of the communications of cavernous sinus. So for this, we will make the diagram. So firstly, the tributaries and communication as seen in this diagram is from the superior view. So we will start making the outline of cavernous sinus. We will use blue color for making the cavernous sinus. So here we have connected the two cavernous sinus on either side, and we have written A and P. Here A stands for anterior intercavernous sinus and P stand for posterior intercavernous sinus. So thereafter we will make connections. Now posteriorly, as we know, there is the sinuses, and here also we are making another sinus following the communications. So just make the outline firstly. So thereafter we are making all the sigmoid sinus, straight sinus and sagittal sinuses. So superiorly we have made one sphenoparietal sinus. The sphenoparietal sinus is one of the tributary of cavernous sinus from the meninges. Other than that, we'll make the other tributaries. So here we will make 3 tributaries on the superior aspect. So these 3 tributaries of cavernous sinus is from the orbit, and just label it. So the first here is the central vein of the retina. We have got superior ophthalmic vein, and then is the inferior ophthalmic vein. So these are the tributaries which is drawn on the upper aspect: central vein of the retina, superior ophthalmic vein and inferior ophthalmic vein. These are the tributaries from the orbit of the cavernous sinus. Now making other important tributaries. So 2 other tributaries which we have made. The one is the inferior cerebral vein. So inferior cerebral vein is the tributary of the brain. Thereafter, the other tributary of the brain is superficial middle cerebral vein. So, superficial middle cerebral vein and inferior cerebral vein are the tributaries from the brain. Thereafter, we will make some of the communications. So, E is for emissary vein. E stands here for emissary vein, which also forms a communication. Now, inside the cranial cavity, so many emissary veins passes through various foramen and they form a communication for the cavernous sinus. So, the other tributaries and the communications we will show. Now, this is the sigmoid sinus, straight sinus, and then it is the superior sagittal sinus. Will go in the superior aspect and form superior sagittal sinus. So, what happens? Other than that, we will show the other communications. So, for this, just connect in the midline, we will make so many of venous sinuses and then communicate it with the foramen magnum. So, through foramen magnum, this basilar venous plexus communicate with the vertebral venous plexus. So, here we can see through basilar venous plexus, cavernous sinus can communicate with that of vertebral venous plexus. Now here we have made IPS. IPS stands for inferior petrosal sinus, and through inferior petrosal sinus, the cavernous sinus can communicate to sigmoid sinus and ultimately to the internal jugular vein. Other communication will be SPS. SPS is superior petrosal sinus, and superior petrosal sinus connect the cavernous sinus with the transverse sinus. So as it is superior view, it is shown like this. So some of these veins is showing the communications and other are the tributaries of the cavernous sinus. So important tributaries which we can see in this diagram is superior ophthalmic vein, inferior ophthalmic vein, central vein of the retina, sphenoparietal sinus which is a tributary from the meninges, inferior cerebral vein, and superficial middle cerebral vein is the tributary from these two are the tributaries from the brain. Emissary vein and anterior posterior A and P is intercavernous sinus. Also we are seeing the other venous communications like basilar venous plexus, and these all IPS, SPS, that is inferior petrosal sinus, superior petrosal sinus is forming communication of cavernous sinus with internal jugular vein and transverse sinus. So these are important tributaries and communication which you have to make in the make the diagram when the question comes, as a long question comes in the examination. If cavernous sinus is given for long question, you have to make the tributaries and communication along with the relations. So just we will complete this. Here we will make a diagram showing relations of cavernous sinus. If cavernous sinus comes as a long question, you have to make a diagram showing important relations of cavernous sinus. So here green color is used for making the two layers of the dura mater. Actually cavernous sinus is formed due to separation of endosteal and that of the meningeal layer of dura mater. So because of it we are making it with green color, and in this two layers between lies the cavernous sinus. So firstly just make the outline of the dura mater. Thereafter we will use a purple color for making the pituitary gland in the purple color. This pituitary gland or hypophysis cerebri is lying in medial relation to cavernous sinus. Now after that, after making pituitary gland, we will just label it, the important structures we will label it. So here as I told you that we have made two layers of dura mater. So the inner layer is the meningeal layer, and coming to the outer layer, it is the endosteal layer of the dura mater. So we have made two layers of the dura mater, inner and the outer. Thereafter, inside with blue color, we are making the cavernous sinus. So what we are making here, the cavernous sinus here. This blue color is used for the outline of cavernous sinus. It has got so many trabecules inside, so it is called as cavernous sinus. So just color it with blue color, showing the trabeculae lying inside. So we will whole color the cavernous sinus in blue. So these are the cavernous sinus made. Thereafter we will make multiple cavernous trabeculae inside the cavernous sinus. So this is the cavernous sinus. Thereafter on the medial aspect, we can see the gland. As I told you, it is the purple color structure is the hypophysis cerebri gland, and this is related in the medial relation of cavernous sinus. So this is the hypophysis cerebri. Now after that, on the more inferiorly in the medial aspect, means medial to cavernous sinus, lies another important structure, that is sphenoidal air sinus. So whole of it will be made with brown color. The outer aspect is made with brown color, and after that we will color it from inside with pink color. So the pink color structure which I am coloring here is the sphenoidal air sinus. So sphenoidal air sinus and that of hypophysis cerebri, that is pituitary gland, is lying in medial relation of cavernous sinus. Now after that, drawing the other structures. So on the superior aspect we have used yellow color, and this yellow color is optic chiasma and tract. So this is on the superior relation. The superior relation of cavernous sinus is optic chiasma and optic tract. Along with it, with red color, the superior relation drawn is internal carotid artery. So this structure which is made superiorly is internal carotid artery. This is internal carotid artery. Now coming to the lateral relations. So in the lateral wall of the cavernous sinus we have got 4 nerves, 4 yellow colored dots. Just mark 4 yellow colored dots for the 4 nerves. So starting from superior to inferior, it is oculomotor nerve, trochlear nerve, ophthalmic nerve, and that of maxillary nerve. So once more, the 4 nerves which are marked on the lateral relation of the cavernous sinus is oculomotor nerve, that is 3rd cranial nerve, trochlear nerve, which is the 4th cranial nerve, and ophthalmic and maxillary. These are both division of the trigeminal or the 5th cranial nerve. Now coming to the structure which lies in the medial wall of the cavernous sinus. So we will make the structures lying in the medial wall of the cavernous sinus. So starting with it, now in the medial relation there is 1 artery and 1 nerve. So the red color is used for marking the medial relation. So in medial relation of cavernous sinus lies the, or lying in the medial wall, it is exactly in the medial wall. So it is internal carotid artery. The red color structure made is the internal carotid artery, and the yellow color structure made is that of abducent nerve. So these are the important structures related to the cavernous sinus, and the diagram which I have made is actually a coronal section through the cavernous sinus. So it is a coronal section through the middle cranial cavity, so that we can see all the important relations of the cavernous sinus. So always label the diagram and also write the heading of the diagram. So the relation which is drawn is taken in which section. So here coronal section through middle cranial fossa is drawn, and this is showing important relations and contents of cavernous sinus. The contents which is shown here is the content of medial and lateral cord. Medial wall contains internal carotid artery, abducent nerve, and lateral wall contains the oculomotor, trochlear, ophthalmic, and maxillary nerve. So this is all for the cavernous sinus. Thank you.